This is a short video containing some facts about ketamine. Ketamine has been around for quite a while and was originally used as a surgical anesthetic. Because of its low price, short duration of action, and induction of powerful dissociative experiences, ketamine has become quite popular as a recreational drug. Ketamine belongs to a class of drugs called dissociative anesthetics. That means it separates your perception from sensation. It also has mildly hallucinogenic properties. In recreational use, ketamine is sold as a fine white powder and is usually snorted or occasionally injected. If snorted, the effects of ketamine take around 5 to 15 minutes to come on and tend to peak after about 1 hour. So, what are the effects of ketamine? Users report feelings of euphoria, calmness, a sense of connectivity, spiritual understanding of the world, pain relief, numbness, and less desirably, loss of motor function, slurred speech, confusion, disordered thinking, nausea, and vomiting. And with very high doses, you might find yourself in the K hole, where you become unresponsive to external stimuli and experience vivid and sometimes unpleasant hallucinations. You should know that, as with any unregulated drugs, you are taking a small but potentially very serious risk with your health. Ketamine, in particular, is what is known as a central nervous system depressant and should not be mixed with alcohol or other drugs with a similar effect, such as opioids or benzos like Xanax, Valium, and clonazepam. Accidentally going into the K hole in a busy or unsafe place can put you in a potentially very vulnerable situation and can be a scary experience. Ketamine tolerance builds up quickly, and you could end up needing to use larger doses to get your desired effect. And as with anything of a psychotropic nature, there is a potential for addiction to develop. You should also know that if you're taking ketamine regularly and you start to experience cramps in your abdomen or find yourself needing to pee more often, or you're seeing pee with blood in it, then these could be signs that ketamine is causing damage to your insides. And in serious cases, people have had to have their bladders removed as a result. Ketamine is a Class B drug, which means that it's illegal for you to have it for yourself, to give it away, or to sell it. You could get prison time or a fine if you're caught by the police with it. And remember that getting caught with ketamine on campus could put your place at university in jeopardy. Withdrawal from ketamine, otherwise known as a come down, can be an arduous, depressing affair, and you might feel drained and anxious while your body gets back to normal for a few days after using. If you do decide to take ketamine, you should stay well hydrated before, during, and after using it. Make sure you don't try riding a bike or driving a car if you're under the influence of ketamine. And if you're with somebody using ketamine and they collapse or become unresponsive, call 999 and seek immediate medical attention. Remember, you won't get in trouble for doing this. The sources for this video and further reading can be found here. And if you would like to get in touch with the university student support team to talk about anything at all related to well-being, just message us at studentservices@fxplus.ac.uk.